Now, for the introducing panel, today we have here with us is Margaret Su, who is a third-year pharmacy student at the University of Waterloo. She will be presenting to us about her journey as a woman in STEM, her passions towards increasing the female representation in the STEM fields through her work as the event coordinator, VP External, and now the co-president of the Women in STEM Club at the University of Waterloo. I will now give the floor to Margaret.
Hi, everyone. Thank you for having me. It's a real honor to be here. I don't think I've ever had an experience like this myself when I was in high school, so I'm really glad to be seeing that there's so much work being done so early on. So I'm just going to share my screen really quick. Bear with me for one moment. Okay, awesome. I want to start off by doing a really quick disclaimer. I will be talking about my experience as a woman in STEM. These are specific to my experiences and as well as my experience to Waterloo. Whatever I say here has nothing to do with Waterloo, just so that I don't hold them responsible for anything I say that might be not within their guidelines. And as well, I do represent myself, I identify with she, her pronouns. So these will be specific to my experiences as a woman. These experiences are going to be different for everyone, and I recognize that gender exists on a spectrum. So I'd be happy if you have any questions to direct you to the right person to talk about the experiences that don't fall within my scope or my experiences, but I will try my best to cover my bases as much as possible. Okay, so I'll start with a little introduction about me. I was born and raised in Mississauga. And I come from a small family of four consisting of my parents, my older brother, and myself. And I also have a lovely dog pictured here in the corner. Her name is Kelly. As you already know, I'm a third-year pharmacy student at the University of Waterloo, which unfortunately occupies the vast majority of my time. But when I'm not doing school-related things, I do like to watch TV and indulge in my old lady hobbies, which consist of embroidery and sewing. So I'll talk about my academic journey a little bit. So I graduated from high school in 2017, and at this time, or at least when I started grade 12, I was actually pretty unsure about what I wanted to do. And I was very fortunate that when I was in grade 12, I had a lot of spares on my timetable. So I took the opportunity to do a co-op, which was offered through my high school. And I did this co-op at Shoppers Drug Mart as a pharmacy assistant. I really liked my experience. I felt like I learned a lot and I experienced a lot of growth. So that prompted me to pursue a career in pharmacy. So in 2017, which was also the year that I started university, I entered the honor science program at the University of Waterloo. And for anyone who hasn't really looked into post-secondary programs and things like that yet, honor science is basically just Waterloo's version of life science. In 2017, or I should say starting in 2018 and I finished in 2019, I applied to the pharmacy school at the University of Waterloo, and I was very lucky to get in. And so in 2020, I started my journey in the pharmacy program at Waterloo. So I did, all throughout 2020, I did a long, painful 12 months of academic term. And then at the very beginning of 2021, I did my very first co-op. So that was at the inpatient pharmacy at Mississauga Hospital. And some of my responsibilities here consisted of things like preparing medications for patients and coordinating things like availability of medications with the pharmacists that were working with me. After my co-op at Mississauga Hospital, I was there for 4 months. I went back to school for 4 months during the summer. And then at the end of 2021, starting in September, I did my second co-op. And that was at LMC Healthcare. And LMC Healthcare is sort of like a doctor's office, and they specialize in endocrinology, which is just a fancy word for the study of hormones and how they interact with the body. So LMC Healthcare covers things like diabetes, thyroid disorders, PCOS, a little bit of osteoporosis and things like that. But as a pharmacy student at LMC, my responsibilities were mainly working with patients living with diabetes. So a lot of my day-to-day tasks included reviewing medications with patients, making sure that they were using them correctly and it was working for them, providing education on how to manage their diabetes, without the use of medication. So that's what we call non-pharmacological strategies. And we also had a few patients who were like starting insulin, starting new medications, or other diabetes devices like glucometers. So the pharmacy would teach them how to use those as well. So I did 4 months at LMC as well, and now I'm back in school, and I just started my 3rd year. And then in the spring, I'll be going back for my last co-op, which is going to be at the Neighborhood Pharmacy Association. This one's going to be a little bit different. So what the Neighborhood Pharmacy Association does is it advocates for the rights and the resources for pharmacists practicing in the community. So that would be like the pharmacists you see at Shoppers or at Rexall and things like that. So what the Neighborhood Pharmacy Association does is make sure that the voices of community pharmacists are heard and that they have the resources to help better serve their community. So how did I get here? I obviously woke up one morning and I was like, I want to do pharmacy for the rest of my life. So there's definitely a process that came to that. I didn't know for a long time that I didn't know that this is what I wanted to do. But I would say I was very lucky. I think I've always known I wanted to pursue something in science. I kind of flip-flopped back and forth between what it is exactly that I wanted to do. But I think the very first job that I ever really, really wanted to have was to become a veterinarian. There was no real rhyme or reason for that. I just really liked animals. But if you get to know me, you'll know that I'm like a really big softie. So if I see like any animals in like any sort of remote pain, I think that would just like crush me. So that was probably not a great idea for me. That was sort of like my elementary school dream. In middle school, I decided I kind of want to explore other things. So for a while, I was really interested in research. Again, for no real reason, I just thought it was really cool. Not pictured here, but I also wanted to do marine biology and neuroscience. Again, just because I thought they were cool. And then when I got to high school, I was like, okay, I need to start thinking about what I want to do because the courses I take in high school are going to affect, what options I have when I apply for university. So I knew that something I was looking for at that point was interactions with people. I wanted to connect with people. I really enjoyed storytelling. So I figured the best way to do that and still pursue a career in the life science / the health science field was to become a nurse. So being a nurse was sort of the end goal. I wouldn't really say it was something that I really, really dreamed of doing or I was particularly passionate about, but I knew I would enjoy it. So I figured I could go for nursing for now. And then if that changes, then, it'll just be more years in school. So I basically spent the vast majority of my high school years working towards nursing. And then you guys have heard this part already. I mentioned it earlier. At the end of my grade 12 year, I had the opportunity to do a co-op. So I did that at Shoppers. And I really liked my opportunity. I didn't know anything about pharmacy practice at that point. So I decided to give it a go. And I really liked my experience. So I decided to change career paths last minute. And here I am. So what are some of the barriers to success that I've had in pharmacy practice? First of all, I want to say I'm very lucky that pharmacy practice is actually majority female, which is amazing. I can't speak for like international rates and I don't know the numbers off the top of my head, but in Ontario, most of the grads that come out of pharmacy school are female. And I can see that in my class as well. I think we have like probably 125-ish people and there's like maybe 15 male identifying students. So most of us are female and I do love the solidarity that comes with that. So while I don't really face that much discrimination or experience a lot of disparity in the workplace, of course, there's always going to be, those patients that aren't the nicest to you. And there's something very particular, I think, about working in healthcare that I didn't really see in any other sort of industries that I've worked with. And it's that we work with old people a lot. And if you enter the healthcare system, you'll know that a lot of the people being treated are people who are old because our population is aging, and being old is generally associated with needing more medical care, needing more medications, having more needs in general and things like that. So something that I see often is that a lot of patients, and when I say patients, I'm referring here to like older patients and sort of the more conservative thinking patients. A lot of them will just assume that the men behind the counter are the pharmacists and that any women behind the counter are like assistants or techs, which is really unfortunate. I can't tell you the number of times that I've heard people say, oh, like I want to talk to the pharmacist, even though like the person they're talking to is very clearly wearing like the white coat. They have like a name tag that says they're the pharmacist. But they just like won't take no for an answer. And that's unfortunately the reality of some of these things. And of course, as with any customer or patient facing job, you'll have people make unnecessary comments to them when you're helping them. One thing in particular, or one example in particular that I can think of is one time I was working at a pharmacy. It was a very small pharmacy. We weren't affiliated with like any big banner or brand names like Shoppers or Rexall was. We were just kind of like our own thing. And if you've been to a Shoppers or if you've been to a Rexall, you'll probably know that they have like a cash register right where you pick up your medications. Unfortunately, the one I worked at didn't have that. We just didn't have the capacity. So what we would do is we would walk people's prescriptions up to the front and cash them out there. So that was what I did for one of the patients. He was an older gentleman that came to pick up his medications. So we had kind of finished the counseling, and then I was like, okay, I'll walk you up to the front and I'll cash you up there. And there was another gentleman standing behind him who was also waiting for his prescription. And out of nowhere, he was just kind of like, I don't understand why you had to do that. Like, that's so unnecessary and rude. And he was basically going off about how like he didn't like that. But then he finished off with, but at least you're cute. And I just remember like feeling so ashamed in that moment that I couldn't say anything because I had to maintain professionalism in the workplace. And I just felt like really embarrassed to be in that position because like there were other patients in the pharmacy as well. So you'll always get like the one or two people who just like make the unnecessary comments that are just so unwarranted in the workplace. Something else that I think is often overlooked in the medical field is, at least that's specific to females, is that a lot of research studies and the results of them aren't representative of half the people they're treating, so females. And when I say females, I'm referring to people born with like 2 X chromosomes, for example. So historically, they have been excluded from research that looked at how well a medication worked or how safe a medication was. And that was because society generally expected women to eventually be caretakers or eventually bear a child biologically. And so because they had that sort of societal expectation put upon them, researchers would be like, oh, we don't really want you in this because we want to make sure the baby has the highest chance of survival at the time of delivery. And we didn't want, or they didn't want the medications to compromise that opportunity. So mothers were often, or women of childbearing age were often excluded from these studies. So first of all, we don't really know what that means in terms of the medications that were studied. Are they really safe for women? Do they really work for women? We also don't really know that. And because we had so many people that were excluded from these studies, in general, we just have like very little knowledge about some of the experiences and some of the health conditions that are specific to women. Because when we go into the doctor and say that, I feel something's off, I don't feel good, a lot of our problems end up being blamed on things like our hormonal cycles, or the assumption that we want attention or that we're just stressed. And they don't really take our problems as seriously as they would if a man were showing up with the same issues. So I want to show you guys something. I'm just going to go over here. So this is a study that was conducted in 2018, and it's about heart attacks in young women. Myocardial infarction is basically just a fancy word for a heart attack. And just by show of hands, can you guys tell me, have you ever seen like a heart attack being depicted like on TV or in a movie? I'm sure you guys are probably well aware that it's a very dramatic, like they clutch the chest and they're like, oh my God, my chest hurts so much, I can't breathe, I feel like there's something squeezing my chest. So if you guys have seen that before, I'm sorry, I can't actually see you, but I'm imagining there's a few hands up right now. If you guys have seen that before, you'll know that that's something that's used very commonly to represent a heart attack. And that is one of the quote unquote hallmark symptoms of having a heart attack, that squeezing or the pressure in the chest, that very sudden like onset of pain in your chest area. It's usually on the left side that people will kind of hold on to. But if we go down to the signs and symptoms section, which is right here, this study actually mentions that, I'll read it out here. some studies have reported that more women commonly present with atypical right-sided chest pain, neck or shoulder pain compared with men who experience typical left-sided chest pain, radiating to the left shoulder and jaw. So right off the bat, we can see here that women do experience some of these things a little bit differently than how men do. As well, 96% of women documented prodromal symptoms, and prodromal means they sort of have like a feeling or some kind of inkling that something is going to happen soon. It's almost like they're predicting something that's going to happen in the future. So 96% of women documented prodromal symptoms at the time of ACS, which stands for acute coronary syndrome presentation. Unusual fatigue and sleep disturbance were the most common symptoms. So here, unusual fatigue, sleep disturbance, these are very non-specific things. Like literally anything can cause somebody to feel a little bit more tired or not get a good night's rest. And as well, women reported more prodromal symptoms than men and a greater number of symptoms, including fatigue, sleep disturbances, anxiety, arm weakness, or discomfort. So what I wanted to highlight in this study here was that women will show up, like, for example, to the doctor's office, and they're like, you know, I haven't been sleeping well lately. I don't know, I just feel like something's off. I don't really know what's going on. And a lot of doctors will write it off as, you know, being stressed, something going on, something happening in their life cycle. Especially for older women, they'll blame it on menopause. And that's significant because we're telling people basically that what you're experiencing is normal, and we're not choosing the right interventions for them because we don't know enough about how women experience certain things. And that's leading to poor outcomes for the patient. A lot of women are less likely to survive their heart attacks compared to men because we just don't recognize these symptoms soon enough. So I feel like that's just important to highlight in terms of why we haven't really been able to make these same strides in medical care for women as we have been for men, because we don't know much enough about you know, their experiences and what they've been having. So I mentioned some of the things that I've experienced so far. So what can we do to overcome these barriers? So the first piece of advice I would give is to not take it personally. And I'm referring specifically to the point I made about people making rude comments or saying things about you that are specific to you as a woman. Chances are if they say it to you, they say it to a lot of people. And as unfortunate as that sounds, I wanted to get across that you're not alone in your experiences and that a lot of women face it. And it's important to build that solidarity with these women alongside you. So that brings me to my next point: set an example for others. So, you know, this is not only about, you know, showing other women in the workplace that you are competent and that they're competent as well, at least the same, if not more competent than their male peers, and as well to speak up about your experiences with a trusted individual. This is something I struggle a lot with still and have historically struggled with, but the more you tell people about their experiences, the more validated your experiences become, at least in my experience. So for example, when I told my coworkers about what that man had told me when I was working in the pharmacy, you know, they were shocked because one of the people I was talking to, he was male. He had never experienced anything like that, and he's never had to because he passes as a male figure. Whereas the other colleague I was speaking to, a woman, she was like, yeah, I've had people tell me that before, and it's really degrading to hear things like that. So when you share your experiences with other people, you get to hear their perspective on things, and you get an idea of, you know, what it's really like. And the more experiences you have and the more people you share your experiences with, the more obvious the injustices in the workplace become, and the more that can be done to address them. And finally, the last thing I would recommend is never stop learning. This is something I hear all the time as well. As I mentioned, there's a lot we don't know about women. That study was conducted in 2018. I know that was a few years ago, but considering how long we've known about the existence of heart attacks, honestly, it's pretty disappointing that we know so little about how women experience them. So take the time to, you know, explore different avenues of learning, and take the time to do your research when you encounter something that you feel like is a little bit off or you don't think is really aligning with what you already know, and prove it to yourself that you know, you can make these distinctions and make what you practice specific to the people that you're serving. So I wanted to finish off with some of the things that I've done. So I mentioned, or sorry, it was mentioned at the very beginning that I am a part of the Women in STEM Club at Waterloo. So I'll just reiterate, I've served as an event coordinator, VP external, and now I serve as the co-president. And a lot of what we do comes down to helping other women at Waterloo build the competencies and the technical skills they need to show their employers that they can trailblaze in the workplace. And ultimately, I think that's something that's really key to helping women feel successful in what they do. So we do things like host workshops about resume critiques. We do mock interviews. We do panelists or Q&A events just like this one to help people connect with professionals in the field and talk about their experiences as well. And we do this for the undergrad students at Waterloo and also some high school students in the KW area. So if you guys are ever interested in anything that we do, feel free to find us on our socials at UW WiSTEM. That's where we do most of our promotion and most of our activities. And I'd be happy to answer any questions about WiSTEM as well. I know other schools also have similar clubs, if not WiSTEM. They might have like specific to science and engineering or specific to like a particular program or faculty. And I encourage everyone here, just as you're doing now, to get involved. Do more, to always try to do more to get involved and learn about sort of the disparities that exist in the workplace that aren't really being addressed. And I can guarantee you that once you've done your part in educating yourself and learning about what can be done, it'll be so much easier to kind of move forward and know what it is that you can do to contribute to addressing these disparities in the workplace. So that's pretty much all I had, to be honest. I've listed some of my contact information below if anyone is interested in asking questions on a one-on-one basis. I'd be happy to take them, but otherwise I want to thank everyone again for listening, and I'd be happy to answer any questions.
All right. Thank you so much, Margaret, for sharing that wonderful presentation with us. I actually wanted to add, because you mentioned that a lot of times when women, they come for checkups and something's hurting, and usually the male doctors, or they would just like dismiss it as menopausal. I remember reading this article, and it was back in the day, but basically when women like had these symptoms, right, and they were panicking because it was really hurting for them and they didn't know what to do, a lot of the male doctors, they would like dismiss it as hysteria, and that became the key thing of like women's hysteria. And it's like very funny because like how that evolved, and we still have that today. And most of the research that is being done through like medicine, that's mainly done for the male body parts and not like for the females, because mainly time when the female uses these medicines, sometimes it doesn't work because other parts are hurting as well. So it was really nice. I like that you touched on that. So before we begin our panelist questions, does the audience have any questions for Margaret? And I know that we do because I saw the chat, and I'm going to the chat and I'm going to be looking at it. Okay, so our first question is, what undergrad science program do you recommend other than the one that you have, which is your honors science program?
So I would say it kind of depends on what your plans are. There are some programs that cater very well to what your plans are after you graduate, whether that's pursuing a master's or another grad degree or going out directly into the workforce. Some programs will help you set up more practical skills. Other programs help you sort of get the prerequisites you need to apply for continuing education. So for myself, I did the honor science program because it was very flexible, and pharmacy just had like a bunch of prerequisites. So I figured with the honor science program, I could get them out as soon as possible. I could get into pharmacy school earlier and minimize the amount of student debt I get. So that was sort of like my game plan going in. I know like other programs have like co-op that go with them if you want to gain some practical skills. Like for example, biochem, I think you get like 4 or 5 co-ops. So that's plenty of time to get practical experience, explore a bunch of different fields. So it's hard to recommend like any single program, but I would say think about what it is you want to do after you graduate, or think about the career path you want to be on in 4 years. And does this particular program cater to the needs of what your plans are going to be?
Awesome. Thank you so much. The next question is, how long did you do your undergrad and pharmacy program at Waterloo? And I think you mentioned this before, but you can just like rephrase it again.
Sure. Yeah. So I did my undergrad degree for 2 years. I want to put out there, I didn't finish my undergrad degree in 2 years. I just did 2 years of the undergrad program. And that was sort of like the minimum amount of time required to get all the prerequisites. And then after that, I'm in pharmacy school for another 4 years. I'm not done yet, but so it's a total of 6 years. But I want to put out there, you don't have to do 2 years, or you don't have to keep it at 2 years before you apply into pharmacy. You can do as many years as you want. A lot of my classmates have done 3 years. A lot of them have finished their undergrads. Some of them have done like master's degrees and they're still coming back to pharmacy school. So you can do like whatever you want. It's super flexible. But just know that like however many years of school you do before you apply for continuing education programs or professional programs, all of your GPAs will sort of contribute to that. So that's just something I would keep in mind.
Mm-hmm. I got scared when you mentioned the GPA part.
I know it's scary. I would say for pharmacy, like it's a little bit more lenient, but in general, like master's programs and grad school programs tend to look at your GPA. So it's a hard thing to swallow. It's a hard pill to swallow, but it's just one of the realities of a competitive school environment, unfortunately.
Yeah, I think I find it scary when you finish your bachelor's and then people are thinking masters and you're like, wait, what? I thought we were
I
done
know some of these people have been in school for like a decade and I'm like, oh my God, I can never.
Okay, and so our next question is, what do you plan to do after the pharmacy program?
So this is a good question. I've been thinking about this for a while now, and I sort of feel like I need to make a decision soon because I'm only like probably a year and a half away from graduating. So I have sort of two main options in mind. The first one is I can go into practice right away. Pharmacists do have to be licensed to be able to practice, so I'll have to take my licensing exam and then I can go out into practice. So I can do that. I don't think I would particularly dislike that because I do really enjoy working in the community. As horrible as it sounds to work in Shoppers or work in a Rexall, like I do find it very fulfilling to be able to see so many people, so many different people, work with a lot of different kinds of medications and be able to provide counseling on such a broad spectrum. But another option I can do is something called a residency. And you guys may have heard this for people in medical school, where they basically do like some years of practice in a hospital setting, which is sort of like how Ontario gatekeeps the medical practice. And it's similar to what we do in hospital practice for pharmacy as well. So it's generally considered that if you do a residency following pharmacy school, it's usually about 1 year long, then you have a better chance of practicing in a hospital. I'm starting to have doubts about practicing in hospital because I feel like it doesn't fulfill me the same way community practice does, like Shoppers or Rexall. So I'm a little bit on the fence about that, but that would be sort of my other option, to do a residency and then eventually work in a hospital after that.
Yeah, I know a friend that she has the same conflict as you, actually. She's just like, I want to work in a hospital, but
Yeah.
I gain a lot of experience with like Rexall and like Shoppers Drug Mart. You get this customer service as well.
Mm-hmm.
And you mentioned that story of where that male person was like, I don't know what's wrong with him. Like, I don't know what happened, but there's like customer interaction is like pretty important, especially if we're working at a pharmacy company and you're the front cashier of it. The last question is, what other program at Waterloo would you recommend that has co-op? And I know you mentioned this for the first question. I think this person mentioned like all the science programs and which ones have co-op and which ones like don't, or how does it look like?
Yeah, so there's a lot of co-op programs at Waterloo, and if you've probably already know this, but Waterloo is famous for their co-op, so it's going to be a very long grocery list. Generally, I would say most programs have co-ops. You won't go on co-op like right away. You'll probably do like a few terms or a few months of school before you have anything to bring to co-op. But I would say most of them do. The only ones I would say that don't is some of them you can actually opt out of co-op, so you'll have a co-op option and a non-co-op option. And the co-op option, you'll just be in school for longer because you spent part of your time working and not being in school. So it's kind of up to you. I know some people choose to not go on co-op because they want to hurry up and graduate. Some people choose to go on co-op because they want the practical experience. It just kind of depends on what your priorities are. The only programs that I know for sure that don't offer co-op, at least in science, are honor science, so the undergrad program that I was in, and biomedical science. So these two don't offer co-ops, but that doesn't necessarily mean you can't get practical experience outside of School, you can definitely look for jobs on your own. You can transfer to other programs and start a co-op there. So there's lots of options and flexibility in terms of whether or not you want to do in co-op and how you want your co-op terms to look like. But yeah, I would say most science programs have co-op, and that's the same for most faculties at Waterloo.
Yeah, I'm glad that there's like flexibility, and like if you don't have a co-op, you can still like reach out and you can gain that experience through like other peers that probably did co-ops and like, reference them or something like networking. The next question is it's about Waterloo in general, but what's the student life like?
So this is hard because I haven't actually been on campus in like 2 years. I would say that a lot of Waterloo students have a lot of Waterloo pride. Like they're very proud to be, like, our mascot is like a warrior, so they're very proud to be warriors. They're very excited about what you can do as a Waterloo student. It's generally quite lively in the Kitchener-Waterloo area because, as you probably know, it has both Waterloo and Laurier there. So there's lots of student life to be around. I think it feels like when you're in the Waterloo area, it feels very safe. You feel very connected to the environment around you just because like you're surrounded by so many students who are kind of in the same place as you. And I think as well, a lot of programs also have kind of like a mentorship or like an older sibling type program. So like it's always encouraged to reach out to your upper years in the same program and ask them about their experiences, ask them for advice. And as well, I know, like, for example, in the pharmacy program, we tend to be quite connected with other years as well because our student government is so intertwined. And it kind of has to be with the nature of our academic and co-op term rotations. So we sort of need other years to take over our positions when we're not in school and we can't really hold on to these roles. So it makes it very easy to connect with the people in your program as well. So I personally really like it. I know student life is kind of a deal breaker for a lot of people when they're choosing what schools they want to go to. So that's something I would keep in mind.
Yeah, definitely. Especially for grade 12s that are going to university. We care
Absolutely.
about a lot. Like, are we going to have friends? Is it
no,
like...
you'll definitely have friends. Like, that's not
depressing?
an option. Somebody will eventually like adopt you as a friend. So I wouldn't worry too much about like not being able to meet people. I know it's been kind of hard with the pandemic and all, but a lot of my friends who have started their university career online have been able to make really close connections. And even just like the people you end up living with, if you live off campus, you're going to be friends with them. So I'm not too worried about that for you guys. I'm sure you guys will be fine.
Awesome. So now we're going to continue to the panelist questions. I was going to ask the first question, which was one of the biggest challenges you face as a woman in STEM. However, I feel like you covered that in the slideshow, so I'm going to just move on to the next question,
Sure.
Which is, what skills do you think are important to obtain in high school to pursue a career in the STEM field? So this could be like referred to like LinkedIn or resumes or applications, anything you just learned in high school that you just really wish like you don't regret at all.
Yeah, so this is a hard one. I would say there isn't like any technical skills that I would recommend learning. It's hard to recommend learning like something specific that you can carry on with you to university because you're going to be spending the vast majority of your university career learning. And that's okay. When you go into university, like no one is expecting you to know anything. Like I know CS students, a lot of them have like portfolios or things that they've already created, but like honestly, you don't really need any of that, at least from the people that I've spoken to. It's totally okay to like go in and like not have anything. What I would say though is as much as you can, and this is hard, this is easier said than done, but try to network as much as possible. Get in touch with people who are already university students, get in touch with professionals if you are able to attend events like this where you have an opportunity to hear about other people's experiences, because not only is that kind of giving you sort of perspective on what you can expect if you follow a similar career path, but it's also setting you up with that connection. You can always, there's definitely nothing wrong with reaching out at a later point saying, hey, I attended this event that you spoke at. I'm really interested in what you do. Generally, I would say like most people love talking about their jobs. So if you give them that opportunity to be like, tell me more about your job, they'll like never stop talking like what I'm doing now. So I think it's always really good to be able to sort of build a network of people that you can rely on in the future to help kickstart your career. And also network with other people your own age that have similar interests. I think it's really hard, especially with everything going online now, that to sort of meet people who are kind of on the same page as you, because everyone in university ultimately will very likely have a different career trajectory. And that's okay, but it's also important to sort of build your own circle of people you can trust and talk about your hardships with. And that's going to make it a lot easier when things get tough and you just need somebody who's going to understand where you're coming from. So both from like an emotional and an academic perspective, I think it's helpful to have just that circle of people that you can trust.
Yeah, networking is probably like the biggest ones I hear from like a lot of university students, and they emphasize like network as much as possible.
Yeah.
So that's like definitely a skill to have behind the back of your pocket as like a way to just, especially for like co-ops and all that stuff. That's like really helpful. I think we have the next question. Okay.
Yeah, so your next question would be, so what is your advice in dealing with people who discourage you from pursuing your career, and how do you deal with the imposter syndrome?
That's a really good question. I don't know if I'm really the right person to answer this question because it's something I'm sort of dealing with and learning something about every day. For people that try to discourage you, it's unfortunately something that I hear a lot, especially for young women trying to get their foot in the door in STEM fields. But I would just say that a lot of them are saying things that are really unwarranted because I guess a good way to put it would be like they want you to, it's almost like they want to see you fail, which is really discouraging because when you enter a very competitive environment like university, you will meet people who become your friends because they want to see your downfall. And it's really sad to see that you're missing that sort of solidarity from your classmates. And that's why I sort of mentioned like it's so important to build that network. But for people who do say those things to you, I would say to, as easy as I'm making it sound, try your best to brush them off. Know who the people are that you can trust. Because if you have people in your circle that are constantly putting you down or discouraging you from the things that you want to pursue, they're probably not the people that you want to keep around long term, because if they're here just to see how poorly you can perform, they're not going to be here to help you celebrate your wins. And it's so important to do that in university because it really, sometimes I'm making it sound more bleak than it is, but it really is hard sometimes to feel like you can be proud of something, especially in a competitive environment. But I want to make it clear that you can celebrate your wins no matter how small, and ideally the people around you should be people who support that. And in terms of battling imposter syndrome, I think something that has really helped me is recognizing that there are other people, even though there are people around you that may seem very accomplished, there are also other people around you who are exactly on the same wave as you. I mentioned that there are people in my class who have done masters or have done like multiple years of school or have gotten practice. And honestly, like the first few months of pharmacy school, it sucked being around them because I was like, what am I doing here? Like, I don't have a master's in like molecular research. Like I don't even have an undergrad degree. Like I don't understand like how I can even compete with them. But if you enter a small net program like pharmacy, you'll soon realize that while there are people who are very competitive, there are others who are honestly here to just make friends. And if that's your mindset as well, I can guarantee it's going to be much easier to make connections with the people around you and to feel comfortable in your setting. So find opportunities to connect with them, talk to them about your experiences if you're comfortable with that, and don't be afraid to open up to the people that you think you'd be able to vibe with, because a lot of these people are going to be the people that are going to be able to stick around long term.
Thank you so much. I really think this is great advice that you've given. Just connect with people around you. And yeah, there will be so many people that will try to drag you down, but it's important just to keep working hard for your dreams. And so thank you for sharing that advice. Our next question would be, okay, so our next question would be, how do you think your job will change post-pandemic, and how's your job changed by the pandemic?
This is a really good question. I love this question because I could talk about this forever. You guys may have seen there has been a large change in the roles that pharmacists have. Since the start of the pandemic, not only have people started coming to us instead of their doctors because their doctors aren't working because they're working online and they can't reach their doctors, but pharmacists still have to work. But we also do the vaccines. We've done rapid testing. We've sort of been like the go-to healthcare provider for literally any health concerns because it has been so hard to access the healthcare system since the pandemic started. So I think that people are really starting to recognize the impact that pharmacists can have. And our job isn't just about counting pills and smacking a label on bottles. It's about, being able to provide people with the care that they need when they are unable to reach the healthcare provider they normally go to. It's about being able to maintain what we call a continuity of care. So being able to continue on sort of where they left off with their last healthcare provider. And as well, it's about the amount of knowledge that we have that we can translate into pharmacy practice. I know, doctors obviously go through many, many more years of school than we do. They have to go through, residency, a lot of practical programs. But pharmacists also have to go through a lot. I'm learning about cancer right now, and the chances of me having to deal in depth with a cancer patient in community practice are probably very, very slim. But we still have to learn it anyways, because within our scope of practice, or the things that we can do, there are things that we can do to help these people manage their chronic conditions or diseases that they've unfortunately been dealt with. And there's a role in pharmacists to play with that to make sure, their treatment regimens are safe and are going to work for them. So I think it's really exciting that the pandemic has sort of shown a light on all the capabilities that pharmacists have. And even before the pandemic, we were sort of updating our scope of practice, or the things that we can do to allow pharmacists to start prescribing medications for some people, given certain conditions are met. So I think that's going to make it a lot easier for people to access the healthcare system. I'm not sure if any of you have experience with this or have heard stories about this, but a lot of people have a really hard time seeing or getting a family doctor, because whether it's about they don't have the transportation, whether it's about a cultural or a language barrier that they have, or maybe they've had a previous negative experience with the healthcare system, or maybe they just don't know how to access it. Pharmacists are so accessible that they could literally walk into the closest shoppers and be like, I don't know what I'm doing. And generally, we're very happy to help the people answer these questions. So I think being able to eventually prescribe for them is going to open up a lot of avenues to help people access the healthcare that they need to maintain their health. And hopefully this is something that I'll be able to put into practice. I know it was sort of put on hold with the pandemic and everything, but it looks like the gears are finally turning, and I'm excited that once I graduate, I'll be able to do those things as well.
Yes, the pandemic has definitely changed a lot, and will change a lot post this situation. And it's certainly become difficult for everyone to adapt to this new environment. But with time, it should get much easier. So we have one question in the chat.
Sure.
Okay, actually, because when you said some people when they come into the pharmacy, I have no clue what they're doing. That's usually me, because I have the paper. I'm like, I don't know what I'm looking for, and so usually the pharmacists are like, calm down or something. You can see my panic expression, which is really helpful. Thank you for that. So there's a really good question in the chat, and it's basically, is there something you think that men can do to help encourage women in STEAM in everyday life?
Yeah, I think this is a really good question. I think something that men could do is to just be open to learning. I think a lot of, at least in my experience, will probably be different for you guys, but in my experience, a lot of men, I guess, it almost seems like they don't feel the need to bridge these gaps because they've never had to experience it in the first place. They don't even know the sort of disparities that we have to face as women in STEM. And it's really unfortunate because what they can do, we have to work 10 times harder. And that's just the reality of a lot of the STEM fields, especially if you enter things I would say science is actually probably one of the easier ones, but if you enter the tech industry, any sort of engineering or math industry, it's going to be very, very, very male dominated. And while that sounds intimidating, it's going to be a really, really good opportunity for you to trailblaze and show the men around you that you are capable and you have the same competencies as your male competitors. So something that I would encourage, if you can encourage the people around you, is just to be open to learning. And that can be, if they're confused about, why we have certain experiences, just make it obvious that like they need to do some research and like not being ignorant about it, sorry. Have them come to events like this and have somebody talk to them about what it's like to experience STEM from a female perspective. And as well, I think this caters to both the people that you mentor and the people who are mentoring you. I don't think it's specific to your peers, but it can be somewhere further down the line. I can guarantee that you're going to encounter somebody younger than you, whether they're male or female. You can teach them about the sort of disparities that are being experienced. Of course, not like shoving it in their face if that's not the point of the job, but like you can tell them like, this is something I struggled with and here's what you can do. Or this is something that a lot of people struggle with, this is what you can do. And even the older people in your workplace, a lot of them are going to be very conservative thinking, especially in the STEM fields. So don't be afraid to be like, yeah, this is my experience as a woman, and I want to make sure this is being addressed, and advocate for your own rights. I remember when I was interviewing for a job at Shoppers Drug Mart for my first co-op, I asked my interviewer, who I presume was an older white male, I asked him what his views are on diversity in the workplace and what he's been doing to address that, at least in his own store. And long story short, his answer was garbage, which is why I didn't end up choosing to go to Shoppers, because if you can't see that when you advocate for what you want to see change in the workplace being implemented by the people that can do it and have taken the time to hear from you, I can guarantee you they're never going to happen, and it's not worth your time to make those strides for people that aren't going to listen. So if you're going to advocate for changes in the workplace, make sure you're talking to a trusted individual about it, and somebody who's going to take you seriously.
That's very true, especially when you're trying to bridge that gender gap. It's important to address the male audience that this is a problem we have. We want you to join it as well, because a lot of times, I know for a fact in my engineering classes and the tech classes I've taken, it's all male, and there's probably like 3 girls, 5 girls, and it's usually like when you go to those fields, it's like almost a norm now that you have 5 girls sitting in a corner and you have just the whole class is male. But yeah, it's really important to address like the male audience and recognize that this is a problem that we all need to solve. And then we're going to move on to the final question.
So our final question is, if there was one thing that you want our high school audience to take away from this panel, what would it be?
I would say if there's anything I could share with you guys and pass the torch on, it's to not be afraid to be loud. There are going to be people out there who don't like the things that you say and are going to try to shut it down. But I would say that if people are trying to shut you down on things that you feel very strongly about and you really think needs to change, and people just aren't having it, then you need to speak louder, because your opinions matter, and the impact you can have in your industries are beyond imagination at this time, especially considering how, for lack of better terms, how woke we are compared to the older generation. Like, there is so much we can do that they don't even know about. So if they're trying to shut you down, like, don't be afraid to speak even louder, and don't be afraid to advocate for your needs, and don't be afraid to talk to others about your experiences. I know it's probably kind of a weird position for you guys now, because you probably feel like you're not really in a position to give any advice, but don't be afraid to be a mentor to people. Being a mentor isn't correlated with being old or being experienced. It comes down to how confidently you feel about something. And if you feel very strongly about something, then don't be afraid to speak up about it, because chances are there is going to be somebody who wants to listen. So I guess the takeaway here is just, don't be afraid to speak up for yourself, voice your opinions, and make yourself heard in the audience that doesn't want to hear you.
Thank you so much. This is very helpful to the audience, including myself. Thank you for sharing the great advice, and I'm certain this will help our audience in the future for sure. So I think we're going to move on to we're going to conclude this panel. Okay, This concludes the end of our science panel for day 1 of STEAM Talks. We would like to thank you, Margaret, for taking the time out of your day to join this event and share some valuable information with us and advice to our audience. I'm certain it is helpful for each and everyone here today. We would also like to thank you all for joining us today. We hope you had a good time and took some things away from this event. Be sure to sign up for the workshops that will be happening throughout this week. We do have day 2 of STEAM Talks for technology happening tomorrow at 5 to 6 p.m. So make sure you don't miss out on this opportunity. And I hope to see you all there. Thank you once again.
Before we end the meeting, I have 2 things to say. First of all, thank you, Margaret, for this inspiring panel. It was really, really great. I loved hearing about your experiences. And I would just like to do the giveaway that we are supposed to have at the end of this workshop and take a screenshot of this meeting. So if everybody, whoever's able to turn their cameras on, if you guys could please turn your cameras on, it would be really great. I'll just give everybody a few more seconds. Okay, 3, 2, 1. Alrighty, and now time for the giveaway. So I will be sharing my screen and it will just be a simple spin the wheel. Can you guys see my screen? Okay. All right, Parmita is our winner. So if you could please put your Instagram in the chat and your email as well, that would be great. Other than that, I will hand the floor back to Krishleen.
Thank you so much, everyone, for attending tonight. Thank you once again, Margaret, for all your advice. So you guys are free to leave. This concludes the end of the panel. Remember, our technology panel is tomorrow from 5 to 6 p.m. So make sure to sign up for that. Bye, everyone.
Thank you so much for having me. Bye.